Bonjour à toutes et tous. Nous allons commencer la petite conférence de ce matin, le Learning from the Field, sur la restitution de l'évaluation des projets et AT de l'initiative en Ukraine depuis 2022. Avant de vous présenter l'agenda, quelques règles de bienséance pour la participation Zoom. L'interprétariat est disponible. Je vous prie de cliquer sur l'icône interprétation en bas de votre écran et sélectionner la langue de votre choix ou de rester en original, puisque la conférence aura lieu en français et en anglais. Sur les microphones, nous vous prions de couper vos micros lorsque vous n'intervenez pas afin d'éviter les bruits de fond et n'activer votre micro que lorsque nous vous donnons la parole. Sur les caméras, c'est quand même plus sympa de pouvoir vous voir en vrai, donc nous vous remercions d'avance si vous pouvez activer vos caméras lorsque vous parlez. Si vous avez des problèmes de connexion, évidemment, vous pouvez la désactiver. Sur les questions que vous pourriez avoir, nous vous remercions de les noter dans le chat ou d'utiliser la fonction lever la main. Une session de Q&A est prévue à la fin des présentations. Nous vous rappelons également que cette session est enregistrée et donc en vous connectant, vous acceptez d'être enregistré. Et voilà, en cas de problème technique, n'hésitez pas de vous signaler à, à nos côtés. Voilà. Très bien. Je vais demander à Emma de prendre le relais sur les admissions des personnes
Pas de
qui
souci, c'est bon.
arriveraient. Et nous allons maintenant commencer avec une petite présentation sur l'agenda de ce matin, avec des remarques introductives à la fois de euh, Sofia Olinik, la directeur pays pour Expertise France en Ukraine, Laetitia Dréan de l'unité SERA au sein de l'initiative et de Vincent Vial, chef de projet santé en Ukraine pour Expertise France. Puis nous passerons ensuite à la présentation des résultats de l'évaluation qui s'est tenue entre avril et juillet 2025, avec une introduction du portefeuille de l'initiative en Ukraine, la vidéo d'un bénéficiaire du projet CoMPSSS, ainsi que les recommandations et évaluations de Anna et Maria, les évaluatrices indépendantes, et enfin euh, questions sur le réabondement de notre fonds d'urgence faite par nous-mêmes et une session de Q&A à la fin, ainsi qu'un petit quiz pour ceux qui seront restés jusqu'au bout. Je vais maintenant passer la parole à Sofia Olinik pour présenter les activités d'Expertise France en Ukraine.
Ouais. Merci beaucoup, Antoine. Bonjour à tous et toutes. Je suis très ravie d'être avec vous en ligne, mais je félicite à toute l'équipe de l'initiative qui était tout le temps en contact avec nous et cette coopération très amicable et très utile pour l'Ukraine pendant ces temps pas faciles du tout. Justement, je vais changer en anglais pour aller plus vite et c'est un peu plus facile. Hop. So first of all, thank you so much. And maybe to give a few words on operations of Expertise France in Ukraine and the dynamics that has changed over the last few years, because I think it's absolutely essential also to frame in the which context we are working and how all our joint work is important for Ukraine and all our beneficiaries on different levels. If we go to the next slide, Expertise France in Ukraine has been operating since 2006, ensuring sustainable and coherent approach and support provided to Ukraine, starting both with the national twinning projects, but also through the regional initiatives. This sustainable and continuous support has laid the solid grounds for the cooperation in all the sectors that we are working these days, and which has significantly increased starting from the full-scale war. On the one hand, we see the tragedy happening with and the impact of the war that we see day to day on our partners, on the citizens, on our workers. At the same time, we see the strong mutual and joint will to support and to provide the support to all those who are in need. And I'm very happy and also to emphasize on the support that Kyiv has been providing since the very beginning of the full-scale war, especially to the doctors and NGOs in the crisis context and close to the front lines. Starting from 2023, we acknowledge this is a new page for bilateral cooperation and for Expertise France in Ukraine, with dedication of additional funding from the Ministry of Europe and Foreign Affairs and launching of Maidan facility and funds from CDCS to launch a PEEP project. And I welcome Vincent in the room who will quite sure will tell you more about the work that has been accomplished, together with ongoing work that has been provided by the EU Project Bravo Justice. This ensured the complementary of Team Europe and Team France when responding to the full-scale war. These days, when we turning the page of 2023, Expertise France in Ukraine is working on three cross-cutting topics. And if I may ask for the next slide. This is first and foremost EU integration and supporting Ukraine on the path to the EU, but also recovery and reconstruction. These are the guiding principles of the work that we do and through the work that we accomplish together with our teams and with our beneficiaries and partners here in Ukraine. Since when we started in 2023 with this active presence and where we are now in the end of 2025, we can proudly acknowledge that jointly as a Team France, as Expertise France, we are now operating more than 16 million euros portfolio in Ukraine with 15 regional national projects and 3 projects and having office in Kyiv and Chernihiv and presence in multiple regions thanks to the operations of different projects that we implement. I will start to deliver this. Our staff has increased now when we are operating with more than 70 permanent staff together with international and international and national colleagues, alongside also with the embedded technical experts in the ministry. Speaking of the sectors, and here we can probably acknowledge of our health program and human capital protection aspect. This is one of the pillars of our operations in Ukraine. Alongside with our interventions in the rule of law and justice, as well as in local governance and decentralization, working with communities, providing support to Ukraine in the field of innovation and support to the private sector, as well as economic and financial governance, defense and security, and sustainable development. Mentioning all these 7 sectors that has appeared in the course of the last 2 years, we can probably say that this is a big achievement of the joint initiatives that have been put in place in a very short period of time. At the same time, it is the trust of our donors, but also the big support and which we absolutely appreciate from our partners here in Ukraine. We go to the next slide? Concluding, it's a short period of time of this active presence, as we say, but at the same time, it definitely was not easy. And we have to acknowledge also the context in which we operate and the fast pace that is happening. But at the same time, what is driving all our work here is the objective of being valuable and next to our partners. And also, and I very much appreciate the title of also today's event, Learning from the Field, because being in the field close to our beneficiaries, close to the ministries, agencies, NGOs, doctors, civil servants, etc., is the most important and the core of our cooperation and support that we provide. We don't stop here. I think we are having a lot of demands and needs pending ahead of us, but at the same time, we are all united along with the joint effort and joint cause to support our partners. And I very much facilitate and welcome the work that Kyiv is doing with the NGOs, whom I had also a pleasure to encounter during the year, and wishing you a very good exchange and passing the floor further. Thank you so much.
Merci beaucoup, Sophia. Je vais maintenant donner la parole à Laetitia Dréan, responsable d'unité SERA à l'initiative.
Très bien. Bonjour à toutes et toutes. Déjà, un immense merci d'avoir répondu présent à cet événement. Et effectivement, nous sommes vraiment ravis de pouvoir partager aujourd'hui cette rencontre débat qui vient effectivement ponctuer une année particulièrement challengeante. Ces rencontres débat du CERA, en fait, c'est un moment important, c'est un espace de partage, de discussion. Vous allez voir des résultats et des enseignements en l'occurrence de l'évaluation que nous avons montée sur nos interventions en Ukraine, sur le terrain. C'est important parce que ça nous permet aussi de jeter un œil dans le rétroviseur avec lucidité, mais aussi important pour nous permettre de regarder vers l'avant, vers la reconstruction et préparer la suite. Ce qu'on va vous présenter effectivement ici, c'est bien sûr des résultats et des apprentissages sur nos process pour aussi améliorer aussi bien la qualité de notre travail que tirer aussi des leçons sur ce qui émerge du terrain. Et vraiment, ces moments-là, ce n'ont pas forcément un rapport d'évaluation, vocation à rester dans un cloud ou un terroir, mais vraiment, et on le dit, c'est pas un mot galvaudé, mais renforcer aussi l'impact de nos actions et préparer les étapes d'après. Vous allez voir voilà, des enseignements particulièrement importants. J'en ai un en tête que j'ai particulièrement suivi. C'était surtout cette articulation continuum entre des actions d'urgence pour répondre aux besoins vitaux et des actions de développement pour préparer effectivement la suite et la reconstruction, les étapes d'après. Je ne vais pas monopoliser davantage effectivement la parole et avant de la passer à Vincent Vial, je voudrais aussi remercier très chaleureusement les deux évaluatrices qui ont conduit ce travail, Anna Chaporal et Maria Schwab, ainsi que mes deux collègues, Antoine Pogozeski et Arthur, qui ont suivi vraiment ce travail avec attention et investissement. Donc, merci encore et puis je laisse Vincent Vial quelques mots pour...
Le micro, il est dans la salle, donc c'est
Merci
bon.
à tous.
Okay, I'm sorry, I'm going to speak in English. I apologize in advance. So we decided to talk a little bit about the health context in general without a very deep focus on what the initiative does. And what we wanted to bring up earlier was the mental health impact of the war and on Ukrainian society. Well, then I'm just going to move there. Thank you so much.
So we wanted to talk a little bit about mental health and the impact that it has on the Ukrainian society, but also linking this with the work that the initiative is doing. So on the vision term, what we see in Ukraine is that there is a very large growing mental health burden into people. There are many reasons for this. So we are giving numbers as an example, the fact that over 2,500 children have been killed or injured since 2022, and that the child casualties have raised by 50% in 2024. Later, I will show you other numbers, but this has also raised over the last quarter in 2025 by almost 70 to 80% because of the rise in targeting of the civilian population by Russian forces. What we see obviously is that there is a very sharp rise in PTSD, in anxiety, depression, and trauma, but also that the services are unable to meet the demand that is very large in Ukraine, and that there is an over reliance on international assistance for mental health, particularly at primary healthcare level. So we are talking a little bit about numbers. Obviously, almost 70% of Ukrainians have reported a decline in their health and mental health compared to post 2022. Out of this, about 50 to 55% have been diagnosed with PTSD, which also include refugees out of Ukraine. We are seeing about 20% of prevalence on severe anxiety and about high level of stress around 18%. This is actually kind of spread across Ukraine, not necessarily in the east, but it's showing everywhere, including in central and western regions. And what is also a number that is talking a lot is the fact that the consumption of antidepressant has increased by 50% since 2022, mostly.
when we talk about the consumption of antidepressant, we are seeing what is recorded by the pharmacies, which is not optimal. We are not even talking about the prescriptions that are not recorded. And this is also consistent to what is seen in terms of the use of drugs in Ukraine. We wanted to discuss a little bit about also the army. Obviously, we don't have numbers about how many troops are there. We estimate about 2 million have been either conscripted or in the military or have been deployed. Out of those 2 millions, roughly, about those that have been exposed to combat and the front line, almost 50% of them have been diagnosed with PTSD, which is a lot. And 21% have been exposed and have been diagnosed with complex PTSD. And the rest of them actually have major depression. What we are seeing is that we are seeing very high comorbidities between PTSD and depression, which is almost 50%, and complex PTSD and depression, which is the rest of the 50%. So the mental health situation for those that have been exposed to active combat is really bad. Also, maybe this will be discussed later, but the use of drugs for soldiers deployed in the front line is very high. There are no exact numbers at this current point in time, but basically soldiers cope, with what we're talking about, mental health traumas. They are coping with drugs for most of the time. It's not just about the soldiers, it's also about the staff of the hospitals, the healthcare workforce. Before the war, we were talking about 3 doctors per 1,000, which is actually higher than France at this current point in time. However, this is an heritage from the Soviet Union. So the healthcare workforce is getting older, getting retired. There's been also a lot of conscriptions and people joining voluntarily the armed forces of Ukraine. And thousands and thousands of them that have actually moved out of Ukraine, either as protected status or finding a job abroad. You have, because of this, specialties in Ukraine that are lacking. As an example, child psychiatrists. There is only few of them left in Ukraine because they were able to find jobs elsewhere. It's just an example within many specialties. And very high level of burnout, PTSD and stress, and overall shortage of staff. Next. So very briefly talking about the system itself, what we are seeing is that there are gaps in the system. We see that 80 to 90% of the war casualties that have died could have been saved with a better management of processes. About 40 to 60% of the amputations, even though we don't have numbers, could have been prevented. And this is mostly due to poor management from the onset of the injury, but also to infection prevention control issues. We have seen an increase, as I mentioned, with one of our partners, which is Superhuman Center, about 70% increased admission of children who are wounded for the last quarter of 2025. And in the hospitals in Eastern Ukraine, over 80% of the beds in civilian hospitals are actually used by the military. So I was mentioning the shortage of staff, the burnout of staff in the hospitals, but on top of this, you have also the fact that your capacity of beds has doubled or tripled, and all of this to manage. And of course, this is not just about the staff, it's about, close proximity in the hospitals, people carrying bacteria, antimicrobial resistance, and everyone being in the same room where you have absolutely no infection prevention control systems in place. Beyond this, you have attacks on infrastructure. So WHO has recorded a number of 2,200 healthcare facilities attacked since the onset in 2022 until 2025, out of which 780 health facilities have been damaged or destroyed across Ukraine. And the numbers given during those attacks is that 205 deaths and 600, almost 700 injuries within patients and medical staff in those facilities. They don't just target the hospitals, but also the ambulances and the primary healthcare facilities in the fields. And one thing that is, we share across our problems between the initiative project and the health program of Expertise France is the availability of supplies and drugs and medicines in the fields. So about 50% of the pharmacies across Ukraine have closed since 2022. obviously, there are a lot of issues into maintaining power, which is having an impact on the drugs that are on cold chain. So over 4,000 generators have been installed into the hospitals, but this is not enough. The logistics have been disrupted, but also what we are seeing for the last 6 months is that there is an increased targeting of the pharmacy sector and mostly the factories in Ukraine. And all of this, of course, has caused chronic disease prevention. And we don't have the numbers. We estimate it's for a few million people. So it shows into cancer screening, but also, all the prevention, which has been heavily affected. There is gaps in routine vaccinations in measles, polio, and tuberculosis. And there is, a very much higher vulnerable mortality and long-term deterioration that we are seeing. And also the fact that the reforms that were initiated before 2022 have been slowed down has an impact generally over the capacity of the system to function normally. Next slide, please. So just very shortly mentioning what France is doing. So France has been investing over 200 million euros in support to the healthcare sector in Ukraine since 2022. And this goes through different routes. We have the Crisis Center as an example, financing NGOs, Expertise France, and others for a little bit above 50 million euros. We have also the civil funds of the French government, which has funded 7 projects for 50 million. But also we have then other projects, as an example, loans and diverse funding instruments, totaling those 200 million. Next slide. So in what we are doing beyond the initiative, we have 2 projects that we call the health program. Those 2 projects are financed by the CDCS for 18 million euros and l'AFD for 5 million euros. And we have a very standardized way to work. So one is mobilization of French expertise. We have priority sectors that have been designed by the diary of the social ministries, and which are mental health, physical rehabilitation, antimicrobial resistance, oncology, and surgical care, including surgical reconstruction. And also we've added intensive care and pain management. So we work along those in hospital cooperation, working together with the DAE to actually mobilize hospitals to do those twinnings between French and Ukrainian hospitals. Medical education, support to national healthcare authorities. We finance expertise. So we have about 27 key experts that are deployed into different ministries and national agencies, but we also finance projects. And those projects are with the Public Health Center or the Medical Procurement of Ukraine. We have about 12 projects of construction modernization. We have projects to actually support the delivery, the purchase and delivery of medical equipment. We are doing feasibility studies for the loans for life in the healthcare sector. And also we are doing the coordination with national, regional, and local authorities and the Team France into the health sector. Thank you. Next slide. And just very brief words for MLA. So in terms of the hospital cooperation, we have about 20 MOUs that currently exist between both the work that is done by Ministry of Health of France and Expertise France, and there will be an additional 20 that will be signed. And those are working along the priorities that have been designed by Ministry of Health of Ukraine. We also finance a lot of work between the French and the Ukrainian hospitals into PTSD treatment, but also into physical rehabilitation. And just behind financing the expertise, we also finance constructions either of mental health centers or physical rehabilitation departments, and as well as equipment. And the last point which I'm mentioning is the fact that we are now working with Ministry of Defense into doing a project around tactical medicine to try to reduce, death and injuries and amputations by addressing different factors that I mentioned, which are pre-hospital medicine, infection prevention control, and also mental health and PTSD treatment. Thank you so much.
Thank you very much, Vincent, for an overview of the health, especially mental health and state of the infrastructure of the health system in Ukraine, as well as the portfolio of the health program implemented by Expertise France. Just a little focus on the 2 main core pandemics that l'initiative is working on in Ukraine, on HIV. So as you know, historically, Ukraine had high prevalence, but it made a lot of substantial improvements. And in the 99 visions for 2024, it achieved quite very good results before the end of before the start of the war. Sorry, but now it has approximately 245,000 people living with HIV, the second highest rate in Eastern Europe. And prevention and treatment services for key groups like people who use drugs or inject drug, men who have sex with men, and sex workers have been heavily disrupted by the war, and there's a fear of new contaminations and higher prevalence. Okay. Regarding tuberculosis, also Ukraine had historically a high burden of TB, and the situation improved in the recent years before the start of the war. And with the war, it is expected that the incidence surged from 73 to 90 cases per 100,000 inhabitants, with 39% of cases being multi-drug resistant. So one of the main, most difficult TB to tackle. And as it was mentioned by Vincent, a lot of hospitals and infrastructure has been destroyed. And in the case of TB, special units and special TB hospitals have been destroyed. I will now give the floor to Arthur to present a bit the history of l'initiative in Ukraine.
Tout à fait. Merci Antoine. Donc, comme cette réunion est tout à fait bilingue, je vais continuer en français. Un rapide mot pour remercier à la fois Sophia et Vincent pour leur présentation et la mise en contexte en fait de nos activités en Ukraine. Parce que c'est quelque chose qui nous a tenu à cœur en fait d'être parfaitement aligné aussi avec les ambitions de la France et d'Expertise France en Ukraine via nos activités. Comme le mentionnait Sophia, l'action d'Expertise France sous d'autres formes existe depuis de nombreuses années et celle de l'initiative également en fait, car nos tout premiers soutiens sont orientés vers l'Ukraine à partir de 2014 avec des projets que nous avions sélectionnés via nos appels à projets annuels. Donc, en appui à des organisations comme 100% Life, Of You ou aussi Alliance for Public Health. Et donc, l'Ukraine a été un pays éligible à l'initiative jusqu'en 2019, dans l'accompagnement évidemment donc, des progrès qui avaient été réalisés par le pays dans sa lutte contre le VIH et la tuberculose. Et donc, considérant que le pays avait des besoins moindres, l'Ukraine était sortie de la liste des pays éligibles pour l'initiative. Bien évidemment, après le début de l'invasion russe en Ukraine en 2022, l'Ukraine est revenue dans cette liste et donc nous avons recommencé à pouvoir apporter des appuis à l'Ukraine. Et donc, vous le comprendrez, avec une certaine disruption en fait, de notre expérience dans le pays. Et donc, beaucoup de choses à reconstruire pour être certain d'avoir les appuis les plus pertinents et répondant aux besoins d'un pays dont le contexte avait radicalement changé. Je veux bien que tu passes de l'autre. Donc, à ce jour, le portefeuille d'activités de l'initiative est composé donc de 8 interventions qui représentent un total de 9 millions d'euros de budget d'engagement et qui se répartit donc entre 7 projets et un dispositif d'assistance technique. Et donc, vous le voyez avec diverses orientations, donc évidemment liées à notre mandat, hein, l'initiative, et je le rappelle, en complément en fait, du Fonds mondial de lutte contre le VIH, la tuberculose et le paludisme. Et donc, notre mandat est d'accompagner en fait les pays qui mettent en œuvre les subventions issues du Fonds mondial, en renforçant leurs capacités, en pilotant évidemment des activités innovantes Et donc, dans le contexte ukrainien, on retrouve cette répartition très transversale autour de la tuberculose et évidemment du VIH, et avec aussi beaucoup d'activités qui sont du renforcement de structures. Donc, en lien avec les stratégies et les priorités de la France, du groupe AFD et d'Expertise France, nous avons un intérêt et une attention particulière pour l'intégration du genre. Et nous sommes très fiers aussi d'avoir des interventions qui sont marquées comme exclusivement dédiées à l'appui à des femmes particulièrement vulnérables, et on le verra plus tard. Donc c'est une attention permanente que nous avons. Et donc, comme vous le voyez, donc nos appuis vont principalement pour les catégories les plus vulnérables en fait, de la population. Comme le mentionnait très bien Vincent, on le voit, la vulnérabilité en fait dans la population ukrainienne, elle est répandue, elle est quasiment généralisée. Et à l'intérieur en fait de ces larges catégories de personnes vulnérables, il y a des populations qui sont encore plus à risque. Et donc c'est aussi j'ai envie de dire l'ADN en fait de l'initiative, en lien évidemment avec la prévention des maladies sur lesquelles nous travaillons, d'aller vers ces publics-là. Donc, c'est-à-dire, et comme le mentionnait Antoine, des populations qui sont quand même relativement nombreuses sur les usagers de drogue et qui sont en développement dans un contexte de guerre, en fait, ou pour justement répondre à des situations de stress personnel ou communautaire assez importants, euh, parfois avec des accès à des médicaments qui sont difficiles, eh bien, l'usage d'alcool ou de drogue peut être une solution pour gérer en fait ces situations de crise, et donc avec tous les risques afférents, notamment sur la réduction des risques. Aussi des communautés qui, même avant la guerre, connaissaient énormément de discrimination et de stigmatisation. Les personnes issues de la communauté LGBTQIA+, les travailleuses du sexe, les personnes, les
Incarcéré.
détenus, ou encore les jeunes. Je vais voilà. Donc, notre réponse a été en plusieurs phases. La première phase, quasiment immédiate en fait, a été la création d'un fonds d'urgence spécifiquement dédié à l'Ukraine. Donc, qu'est-ce que ça veut dire pour nous? Et je vous laisse voir les répartitions, hein. C'était déjà un financement de 5 millions d'euros fléché sur l'Ukraine, avec des objectifs vraiment très spécifiques de mise à l'abri, de protection, d'équipement aussi pour passer l'hiver. Il faut se remettre dans le contexte du premier hiver 2022-2023, qui était extrêmement difficile. Et aussi, bah, toujours d'aller sur les populations les plus vulnérables. Qu'est-ce que ça veut dire pour nous aussi, un fonds d'urgence? Ça veut dire une capacité à répondre très vite, à alléger les procédures, à être en soutien direct, en appui à nos partenaires de la société civile ukrainienne, ce qui était un enjeu absolument essentiel pour nous, la capacité à aller couvrir des activités que nous ne couvrions pas forcément d'habitude dans nos modalités classiques, c'est-à-dire par exemple l'achat de générateurs, l'achat de médicaments, de vêtements chauds par exemple, donc vraiment de l'équipement immédiat, et toujours avec cette idée d'être main dans la main avec les personnes et les organisations qui font du service directement sur place, et d'être vraiment en appui direct aux populations les plus vulnérables. Je vais laisser Antoine continuer sur les autres modalités. Et voilà.
Merci Arthur. Effectivement, en parallèle au fonds d'urgence Ukraine fait en 2023, plusieurs projets ont été attribués aux porteurs qui ont répondu à l'appel au projet 2023 et 2024. Et pour ça, il s'agissait effectivement de Alliance for Public Health et Public Health Center du ministère de la Santé. L'Alliance for Public Health avec un projet sur les femmes consommatrices de drogues et substances qui a permis de créer différents refuges et accueil de jour pour elles et leurs familles. On reviendra avec cet exemple, avec une vidéo juste après. Et également donc l'institution du ministère de la Santé, Public Health Center, également sur la thématique des substances et avec, comme le rappelait Arthur, le contexte d'une diversification et une consommation plus importante liée à un état de guerre également. Et également d'intégration européenne, puisque le projet vise à renforcer également les liens et les échanges avec l'Union européenne et les ministères pertinents. On va montrer tout de suite également des résultats que l'on collecte avec nos indicateurs de redevabilité thématiques sur la question de la santé et notamment des pandémies. Vous pouvez voir les indicateurs pour 2023 et 2024 qui montrent qu'il y a quand même eu une part importante d'augmentation sur les personnes qui ont bénéficié des services de santé, à la fois en termes de prévention, de diagnostic, mais également de traitement. Que le nombre de personnes qui ont été mises sous traitement antirétroviraux a également beaucoup augmenté, ainsi que le nombre de patients sur la tuberculose qui ont été reportés et qui ont été également traités avec succès. Je vous partage ensuite une vidéo issue d'un projet CoMPSS qui était donc, comme mentionné, sur les femmes consommatrices de drogue, et ça va nous permettre de voir véritablement le quotidien du projet et des bénéficiaires.
Як ми колись жили, де знайти гроші, потім де знайти дозу, потім де ту дозу вжити, туди-сюди, вже раз і новий день, і все то саме.
Це львів'янка Марта, багатодітна мама, яка вже 2 роки перебуває на програмі замісної підтримувальної терапії, лікуванню, яке дозволяє їй відмовитися від вуличних наркотиків, уникнути симптомів абстиненції, ломки та жити повноцінним життям. Також жінка користується послугами кімнати матері та дитини, створеної в рамках проєкту CoMPSS, яка розміщена в приміщенні Львівського обласного державного клінічного наркологічного диспансеру. Завдяки цьому проєкту у Марти немає потреби стояти в черзі на отримання препаратів ЗПТ разом з дітьми, а також є можливість отримати консультації лікарів та психолога.
Ти довольний, що йдеш гуляти?
Марта, окрім турботи про сім'ю та дітей, має знайти час для власних справ і відпочинку. Кімната матері та дитини стала для неї додатковою підтримкою.
Я, можна сказати, одна з перших, хто почав відвідувати її, так як стою на сайті замісної терапії і отримую препарат. І для мене це дуже комфортно і зручно. Чим зручно? Тим, що я собі зранку зібралася, прийшла з дітками сюди, без проблем лишила на соцпрацівників, на психологів, на дівчаток. Діткам тут і увагу надали, і смаколики, і іграшки. Тобто, я дуже тим задоволена, що вони на хороших емоціях, що вони в хорошому настрої, що я виходжу і вони не плачуть. Тобто...
Доця, заходь. Так, добрий день.
Добрий день. Можна до вас?
Можна. Проходьте.
Опа!
Та ви тут всі?
Так, ми всі прийшли до вас. Так. Вже робимо вам гармидер. Зручно ще, наприклад, в тому плані, що є постійна регулярна підтримка. Я особисто не раз зверталася до психолога, і мені надавали досить такі об'єктивні і доступні консультації. Мені воно дійсно в житті допомогло. Час від часу отримуємо сертифікати на продукти в сільпо, що є дуже зручно, що можна піти взяти і харчування діткам, і памперси при необхідності, і все решта. Наркозалежність – це є діагноз, з яким людина вже працює все своє свідоме життя далі. Вживати наркотики – це просто можна вживати наркотики, кайфувати, знищувати себе, не розуміючи цього. А програма ЗПТ – це вже є трошки інакше. Це вже тоді, коли з тобою працюють люди, це вже тоді, коли ти бачиш, що твоя хвороба і твій стан не є байдужий комусь. Ти розумієш, що є люди, які хочуть дійсно і щиро тобі допомогти. Наприклад, як я отримую ЗПТ-програму, тобто я, можна сказати, і почуваю себе в ідеальному стані, тобто, що мене нічого не турбує, нічого ніде мною не крутить, що я можу собі вільно встати зранку, вільно зібрати дітей, приготувати їм сніданок, зібрати їх на вулицю, прийти сюди, зробити всі свої справи, які мені необхідно. Кімната матері і дитини працює у нас кожен день з понеділка по п'ятницю, зранку до обіду. І чим ще зручно, що це є дійсно біля приміщення сайту ЗПТ. Що ти це робиш все, можна сказати, швидко, якісно і доступно. Якщо прислухатися і попасти до правильних людей і трішечки прислухатися до них, так як колись зробила я і попала на цей сайт, то я зрозуміла, що можна жити без наркотика.
Все, йдемо, ви були чемні? Так? Все, молодці, все, дуже вам дякуємо, велике. До побачення, приходьте. До побачення.
Ми дуже цінимо і радуємося тому, що є ще такі організації, які дають нам підтримку і допомогу. Ну і взагалі хотілося б більше таких кімнаток.
Voilà donc une vidéo qui nous permet de voir également une approche très concrète et intégrale qui permet de subvenir aux besoins des personnes pour pouvoir avoir leur traitement OAT et également laisser leurs enfants avoir une intégration holistique des différents services. On y reviendra justement sur l'évaluation et les résultats quand les évaluatrices Maria et Anna nous en parleront en détail. Voilà, donc nous avons présenté le portefeuille ukrainien et après 2 ans et demi, 3 ans d'intervention en Ukraine, il nous semblait important de pouvoir faire une évaluation qui allait nous permettre de pouvoir également trouver des éléments stratégiques pour la programmation future. Et c'est pour ça que cette évaluation est arrivée. Comme l'avait rappelé Laetitia, nous avons donc fait appel également aux critères de l'OCDE, du CAD, pour guider cette évaluation, tout en ayant également une approche particulière avec le nexus humanitaire développement, ainsi que l'identification de différentes recommandations pour la programmation future. Et c'est donc maintenant que nous allons vous présenter les résultats de cette évaluation. Et je vais passer maintenant la parole à Anna Chapoval.
Bonjour. Can you hear me okay?
Yes, we can hear you.
Yeah, I apologize. I will keep my camera off for now because my signal is really floating. So thank you so much for including us into this gathering and giving us opportunity to speak to the findings of the study. Just to give you a quick snapshot, I think in the next 20-25 minutes, we will quickly talk about the scope of the evaluation methodology. Then I plan on reviewing some of the selected findings. Then to make those findings a bit more specific, Maria will share brief case study snapshots that we conducted in Lviv, Kiev, and Kryvyi Rih, and then we can wrap up with conclusions and recommendations. Next slide, please. So, as Antoine and Laetitia already mentioned, this evaluation was structured around 8 dimensions. The 6 criteria of the OECD DAC, and then we had also 2 additional cross-cutting lenses requested by initiative, specifically strategic orientation and the humanitarian development nexus. And methodologically, this was a mixed method study, and most of the work was accomplished, including the field work, was accomplished in April and May 2025. Next one. So now we will review selected findings, and again we will go, as I mentioned, by DAC criteria. So turning to relevance first, the core question here was whether the initiative's support matched the realities of the need in Ukraine during the war. And we can conclude that overall the emergency fund and the AAP fund were highly responsive to urgent gaps and evolving risks. The portfolio showed a strong emphasis on groups that are often underserved or face higher stigma, such as women who use drugs, adolescents, LGBTQI+, individuals in detention, and other groups. And then we observed that partners repeatedly described the work as grounded in frontline needs rather than shaped by donor templates or requirements, and they really highlighted flexibility, including the ability to reprogram activities as a critical strength. At the same time, you can see here that there are unmet or growing needs that remain highly relevant for the next phase. In particular, those are mental health and psychological support, alcohol and stimulant-related risks, and stronger rural outreach. Next one, please. Coherence, in our case, looked at how well this support aligned with other efforts in the system, and in general, the portfolio complemented national strategies and the work of major donors such as the Global Fund and PEPFAR, rather than duplicating them. In several areas, the initiative was able to support themes that are less visible in larger funding mechanisms, including psychosocial services and youth-focused sexual and reproductive health. And then stakeholders interviewed also noted then that coordination improved over time with increased participation in the CCM consultations and better information sharing. Areas where coherence was less consistent were in early technical assistance, which was not always well aligned with national planning cycles, and a small number of civil society actors also felt less included into the or receiving updates on the regular projects selection process. These are not structural weaknesses, but we can actually say that they do signal where coordination mechanisms could be strengthened. Next one. Effectiveness addresses whether projects delivered the results they set out to achieve, and most of emergency funds and so both streams and regular application projects met or exceeded their targets, despite the very challenging implementation environment. Peer-based models, mobile outreach, and flexible delivery approaches appear to have been especially important to sustaining service uptake. Technical assistance outcomes were a bit more mixed. Stakeholders generally rated the quality of TA as strong, but the degree to which it translated into sustained institutional change depended heavily on the ownership and also on the capacity within the state structures. Monitoring and evaluation practices also varied across grantees, with some partners showing very strong systems and then others needing further support to move beyond output level tracking. Next one. In our context, efficiency was less about cost minimization and more about the smart use of resources under a lot of pressure. So the flexibility of funding played a major role here, allowing partners to adjust budgets, locations, and activity mixes as needs shifted. Semi-annual reprogramming windows, timely donor responses, and a relatively low administrative burden helped prevent delays and reduced the risk of spending on activities that no longer match the situation on the ground. And then overall budget execution was sound, and changes were generally accompanied by clear justification and documentation on the side of each partner. Next one. So when we looked at impact, we were considering the broader effects beyond immediate project outputs. Several emergency-driven service models, including mobile delivery, shelters, and telehealth approaches, have already influenced how partners, and in some cases national actors, think about service organization in wartime and recovery settings. Another visible impact pathway that we observed was trust. Projects strengthened access for key populations in environments where stigma and insecurity or even safety concerns often blocked engagement. And a particularly strong indicator of longer-term effect was the way some participants transitioned from clients into peer navigators, volunteers, or staff at some organizations. Technical assistance also stimulated the relevant policy discussions and strategic work, even though adoption timelines differ across interventions or projects. Next one. So sustainability is obviously a challenging issue, and it was difficult to assess in a continuing war setting, and this slide reflects that reality. There are clear examples of models already moving towards scale, such as TB peer screening in prisons, for example, being supported by other donors, and certain digital platforms being integrated with the state systems. However, many projects also generated durable materials and approaches, for example, training packages and service protocols that partners anticipate continuing to use. However, most interventions remain externally funded, and in many cases, continuity of infrastructure and staffing is not yet secured beyond project timelines. In short, here, sustainability potential was evident through this evaluation, but it will depend on deliberate scale and integration pathways in the future. Next one. This slide captures a cross-cutting pattern in the portfolio. While projects were not formally labeled as Nexus or humanitarian development Nexus interventions, in practice, they have consistently breached emergency response with longer-term system strengthening. Mobile units, shelters, and telehealth were designed as crisis solutions, but they evolved into platforms for sustained service delivery. after that. Flexible funding also enabled that shift, allowing partners to respond rapidly without losing the development trajectory of their work. And of course, civil society partners played a crucial dual role here, meeting urgent needs in real time while also innovating and advancing inclusion. Several pilots are already informing broader standards or donor pipelines, as I already mentioned, and that is precisely the kind of linkage this Nexus approach aimed for. Next one. Okay, and now I'm giving the floor to Maria. I hope she's online and she can. Okay, I see you, Masha. So now we will talk about the 3 case studies that we conducted. Thank you.
Thank you, Anna. Hello, colleagues. So as Anna and other people have already mentioned, we conducted 3 site visits and developed 3 case studies based on them. So this included the network of shelters implemented by Allianz Global. We visited their shelter in Lviv. Then there was the Fight for Life primary care hospital run by 100% Life. We visited their hospital in Kyiv. And finally, there was the gender-oriented program for women with opioid use disorders led by Alliance for Public Health. We've watched the video from their project and we observed their operations in Kryvyi Rih. So I will now describe what we saw on our site visits, and I'll start with Lviv, with Allianz Global. So this project runs from January 2024 to December 2026 with a budget of €500,000, and it focuses on shelter and digital outreach for LGBT plus individuals, including those internally displaced. So the first component of this project is the network of shelters, and it offers shelter to LGBT plus populations in need in Kyiv, Kharkiv, and in Lviv. And in this case, the initiative co-funds premises and staff salaries. So as of May 2025, when we conducted the visit, 187 LGBTQ plus individuals have been supported across all 3 shelters. So residents who receive services at these shelters receive much more than just accommodation. It's also some basic medical support, that's psychosocial care. Sometimes it's legal assistance, help with job search, different sorts of socialization activities, as you can see on the pictures. And a unique feature that we observed in Lviv was a separate basement that was being renovated into a bomb shelter. That's a very thoughtful adaptation nowadays, unfortunately. So people can stay in the shelter for a few months until they get back on their feet, and it's nice to see that some former clients even come back as volunteers or staff. It shows that they trust and want to give back to the community and to the service they received. So when we visited, we got to chat with one resident, and it was obvious that they were really happy with the support they received. And I asked them if they needed anything else, and they couldn't even think of anything else they needed. So it shows that the services they receive are very complex and thoughtful. Can you please switch to the next slide? And the slides are more illustrative. So the second component, the digital HIV prevention campaign, has also been pretty successful. So using different social media such as TikTok, Instagram, Facebook, also Hornet, Allianz Global disseminates HIV prevention messages and offers services through PrEP.com.ua and GetTest.com.ua websites. As of May 2025, again, when we conducted this visit and when we collected the data, these platforms have facilitated more than 3,500 HIV-related service registrations. That's a lot. And collaboration with influencers and different pop stars significantly amplifies the reach of this campaign and hopefully reduces some stigma that is still associated with HIV services. and HIV prevention. So telemedicine associated with these two websites that's provided through GetTest.ua and PrEP.com.ua has been another good practice that we observed. So because many MSM and LGBTQ plus in general face different mobility restrictions due to war-related issues. This was very helpful to them for them, and this way they can receive HIV tests and PrEP remotely when otherwise it would not be possible for them, or it would just take more time. Next slide, please. Thank you. So after Lviv, we visited the Fight for Life project that's implemented by 100% Life. They have 4 hospitals in Kyiv, Chernihiv, Poltava, and Rivne, and we visited the one in Kyiv. So this project operates from January 2023 to December 2025 with a budget of 1.5 million euros under the Emergency Fund for Ukraine budget line. Its purpose is to ensure the uninterrupted access to HIV services, primary care, psychosocial support, mainly for people living with HIV and those at risk of HIV, but not only them. So at the 4 medical centers in the cities I mentioned, the teams offer a very wide variety of different services. That's they start with IRT, PrEP, OST, and or rather extend to primary care, STI testing, mental health support, and so on. What really sets this model apart is that medical care comes hand in hand with some social support from social workers and peers, often peers that are social workers. So they even have their own office where they can provide counseling. And if you switch to the next slide, you can see it on the pictures. Yeah, so the two first pictures are a picture of the room where the counseling by social workers is provided. So it makes it much easier for clients to feel supported and stay engaged in their care because it creates safe spaces for them. Despite the war, the program maintained licensed OST services in Poltava, and besides, 100% Life is the first private HIV care provider that's contracted by National Health Service of Ukraine. That's a government agency that's responsible for funding and overseeing healthcare service provision in Ukraine. And we think that it's a very important development for sustainability of this project. One of the important adaptations that has been remote and postal delivery of IRT and PrEP, and this includes international shipments. This approach significantly reduces access barriers for people that were internally or externally relocated, and hopefully improves their adherence to treatment and prevention. The project also procured and distributed some essential medical equipment to ensure continuity of care provision. For example, to provide frontline providers, they purchased 821 units of body armor and almost 6,000 thermal clothing sets. Also, more than 25 liters of fuel were purchased to ensure that the services are provided. For example, emergency services, mobile outreach, and so on. And in total, as of beginning of 2025, almost 18,000 people have been served across these hospitals. Next slide, please. So the last site we visited is operating within the project scope of Alliance for Public Health. It runs from January 2024 to December 2027 with a budget of 1.5 million euros as well. So this program focuses on support of women who use drugs. of mothers who receive OST and women who have survived violence, but this service is mainly located in Dnipro. We visited the mother and child room in Kryvyi Rih. This network actually expands to not only Kryvyi Rih, but also Kyiv, Dnipro, Odessa, and Lviv. These rooms are designed to be easy to access and offer medical, psychological, legal, and other kinds of support. And they allow women to come in with their children to receive these services. So everything they might need is gathered in one place, and it's much easier for them to actually use the services and not stress about logistical issues. So as of March 2025, almost 500 women have received services at the project's 5 sites. And in total, over 5,000 consultations have been delivered, different consultations, legal, psychosocial, medical, and so on. Also, 93 survivors of gender-based violence accessed services through the dedicated green room in Dnipro. Mental health is a major component of this project. So 98% of women that accessed these services were screened for depression, and 72 of them screened positive. Of this, 90% received some form of mental support. The program also integrates antidepressant therapy into harm reduction, which is a very unique feature as well. Another significant achievement is that 23 women received HPV vaccinations. It is the first time in Ukraine that women on opioid agonist therapy receive HPV vaccination. So another great practice observed. Behind these results, several innovative approaches. First, peer navigators, women with similar lived experience. So they play a vital role in outreach and engagement, and this helps build trust with clients who often avoid traditional services or traditional models of services due to fear of stigma and discrimination. Staff also often comes with women to their appointments, for example, to legal appointments or medical appointments. This is also very important because in Kryvyi Rih, for example, the length of the city is almost 120 kilometers, and it's very difficult for some women to actually reach or access some services. And so it's very handy because social workers often use their own transport, their own vehicles to bring clients to these services. The project also uses conditional support, such as food certificates, to encourage health-seeking behavior. So these are distributed to those who receive some sort of service. And this approach is used to gently nudge women towards beneficial behaviors. I think we have another slide here with pictures. Yes, thank you. In general, the collocation of services and child-friendly environment are essential for mothers because many of them also fear losing custody, and unfortunately they fear overwhelming structural barriers, and peer-led outreach strengthens engagement and trust. In general, when we integrate all the services, we fill the gaps that are otherwise inaccessible to this specific population. That's all for case studies. I'll pass the word next to my colleagues. Thank you.
Thank you, Maria. So now we will be moving into a discussion of recommendations. As you're going to see on the next few slides, we systematized recommendations by several domains, and the first one is strategy and policy. So here, partners emphasized the need in strengthening the initiative's visibility and positioning in Ukraine. In practical terms, that could mean a clear and more consistent in-country presence, in coordination spaces such as the Ministry of Health, CCM, and EU-related forums, along with more systematic communication on what the initiative is contributing and achieving. In the same strategic area, we also recommend aligning support more explicitly with the Ukraine's EU accession and reform agenda. The idea is here to connect community-level innovations with a broader EU and WHO reform tracks so that the emergency-driven progress also supports long-term convergence. And finally, here we also point out to health governance and leadership. The recommendation here is to invest in leadership development and institutional memory so that reforms and innovations developed as part of this outstanding program are not dependent on a small number of individuals, but can be sustained through stronger systems in the future. Next. Thank you. The second area of recommendations is programmatic focus. First, we call for prioritizing mental health and psychological support, which is in line with what other colleagues already mentioned today. This includes funding trauma-informed integrated psychosocial care for key populations, and importantly, dedicated support for the mental well-being of healthcare workers. This was also brought up many times, as healthcare workers in Ukraine right now are operating under extreme pressure. Next, a lot of partners recommended expanding attention to emerging and underserved groups whose vulnerability has been created or intensified by the war. Such groups include veterans, people living with war-related disability or trauma, displaced populations, rural communities, sex workers, and others. And the emphasis is both on who is reached and on extending geographic coverage where gaps remain. And finally, under this domain, we reiterate the importance of comprehensive harm reduction and addiction services. The recommendation is to broaden the response beyond opioids, strengthen and standardize care protocols, and integrate prevention and addiction care more fully into primary healthcare systems. Next one. A third set of recommendations relates to funding and delivery models. And here we encourage the initiative to maintain and expand flexible emergency funding as a core instrument, including rapid reprogramming capacity as needs change quite rapidly in Ukraine at the moment. We also recommend simplifying access for grassroots civil society organizations. This means reducing entry barriers and offering practical support such as proposal coaching, lighter reporting, and micro-grant mechanisms so that smaller organizations with strong community reach can participate. In addition to that, we underline the value of having formal pilot to scale pathways. The idea here is that successful pilots should be designed from the outset with clear scale-up plans, including using the regular project stream as a bridge toward global fund or state-supported funding. And finally, we would like to reinforce the importance of mobile medical teams. The recommendation here was to expand this support and strengthen integration into national systems, including alignment with the National Health Service of Ukraine funding mechanisms and Ministry of Health planning. Next one. In the area of monitoring, evaluation, and learning, we recommend introducing a unified but light, so to say, light MEL framework across modalities. The aim is here to agree on core shared indicators, including some outcome level measures, such as retention or service use change, while keeping reporting manageable for partners on the ground. Closely linked to that recommendation is a recommendation to actively support male capacity among grantees through tools, mentoring, and training, so partners are able to track results and adapt in real time. And finally, under this domain, we recommend more systemic documentation and knowledge sharing, for instance, through potential Ukraine Learning Hub or other regular mechanisms, existing mechanisms, so that lessons and innovations circulate across the portfolio rather than remain within individual projects. Next one. Finally, here we focus on coordination and system integration. Under this domain, we recommend supporting a practical donor coordination platform that is co-led with the Ministry of Health and the country coordinating mechanism and backed by a live who funds what and where dashboard. The purpose is to reduce fragmentation, avoid duplication, and identify gaps more quickly. Alongside this, the partners also emphasized promoting the integration of effective NGO-delivered models into state systems and budgets. The intention is to transition successful civil society services, for example, such as mobile teams and other proven approaches, into routine public financing and planning so that they can continue working beyond individual project cycles. And I think this is the last slide, so I'm gonna leave you with that. I just want to thank Artur, Antoine, Letizia, and the rest of the team for like this really exciting collaborations. And I know that we will have Q&A a bit later. Thank you.
Thank you very much, Anna.
Effectivement, un grand merci aux deux évaluatrices, Anna et Maria, qui ont réalisé vraiment un travail de fond, de qualité et qui nous est très utile en fait. Et je pense que Laetitia ne me contredira pas si je dis qu'une évaluation, ça sert surtout en fait à aller de l'avant, à préparer la suite. Et c'est ce que nous avons vraiment voulu faire parce que nous savions qu'en 2025, nous avions beaucoup de préoccupations stratégiques et de potentielles ressources additionnelles qui viendraient. Et donc, nous voulions être le plus près possible, en fait, à continuer à répondre au mieux aux besoins en Ukraine. Et c'est ce que nous maintenons au cœur de nos activités chaque jour, c'est de répondre à cette question, comment pouvons-nous faire le mieux avec ce qu'on a? Donc, c'est pour ça que cette évaluation vient se placer dans dans ce questionnement. Donc, en septembre dernier, nous avons eu un accord pour avoir, par exemple, 1 million d'euros de ressources additionnelles pour le fonds d'urgence Ukraine. Et donc, grâce à cette évaluation qui a été menée par les évaluatrices, nous avons pu intégrer des recommandations dans la programmation de ce réabondement du fonds d'urgence en se concentrant sur différentes orientations, mais surtout, euh, comme, comme les ressources sont contraintes dans un environnement de financement qui est parfois difficile, en particulier en 2025. Nous avons fait un choix clair et assumé de continuer des appuis sur des projets qui sont en cours sur le fonds d'urgence pour des organisations qui ont parfois des accès plus difficiles aux sources de financement externes. Et donc, nous avons tiré des recommandations faites par cette évaluation, différentes orientations pour la continuité d'activité ou leur extension. Donc, toujours maintenir ces activités de protection et d'appui vraiment direct aux populations les plus vulnérables ou peu desservies, parce que c'est ce qu'on remarque en fait, c'est que ces populations accèdent à des services de santé aussi grâce à ces services qu'on leur propose, qui vont au-delà des services de santé. Comme on l'a dit depuis le début en fait, de cette réunion, et comme Vincent a bien insisté dessus, un focus sur la santé mentale. Dans le contexte ukrainien, dans ce contexte de guerre, toute intervention sans prendre en compte la santé mentale des personnes qui seront impliquées dans le projet, et je parle y compris des personnels en fait qui mettent en œuvre le projet, peut être à risque en fait. Et donc c'est vraiment extrêmement important à la fois dans les activités, mais aussi l'appui programmatique aux équipes et aux organisations de l'intégrer. Le renforcement, évidemment, des activités au niveau local et régional, notamment en développant des activités sur des régions où nous n'avons pas encore travaillé et où les besoins sont toujours nombreux. Et évidemment, dans un contexte où les ressources sont contraintes, où il faut de manière permanente imaginer en fait d'autres manières de faire et travailler sur aussi la durabilité en fait de ces appuis pour les rendre moins dépendantes des aides externes et que le pays soit en capacité de les intégrer. Et c'est ce que Maria et Anna ont bien relevé, je pense, à travers les activités que nous menons. Donc j'en reste là et je repasse la parole à Antoine qui va lancer la... Ah, c'est parti.
Merci beaucoup Arthur. Vient maintenant effectivement la partie Q&A et discussion. Donc nous invitons les personnes à se manifester si elles ont des questions, soit à les écrire dans le chat, soit à lever la main ou prendre la parole. Et il y a également un petit quiz WooClap qui nous attend après. Mais voilà, nous avons un temps d'échange maintenant et je serais très intéressé également d'avoir le retour des partenaires ukrainiens qui sont connectés avec nous aujourd'hui. Voilà, donc je regarde s'il y a déjà des...
Et qu'on remercie chaleureusement d'avoir participé.
Effectivement.
Alors, ça peut être des questions, ça peut être des remarques, des partages d'expériences sur le travail avec l'initiative, vos idées par rapport aussi à la stratégie, aux conclusions de l'évaluation et peut-être les recommandations qui ont été faites par les évaluatrices. Donc, n'hésitez pas à faire connaître vos pensées, s'il y en a, bien entendu.
Bonjour, puisque personne ne parle, est-ce que je peux prendre la parole? J'ai pas vu de petites mains, donc j'ai pas vu si vous m'entendez.
Oui, vas-y Jean-Élie.
Voilà, alors je me présente, je suis Jean-Élie Malkin, Antoine me connaît. Je suis actuellement ETI, conseiller ministre de la Santé de Roumanie, 3 ans. J'ai travaillé un peu avec Antoine sur ses démissions avant en Géorgie, mais surtout j'ai vécu 4 ans à Moscou et comme directeur régional de l'ONU-SIDA, j'ai vu qu'il y avait une participation de l'ONU-SIDA et 7 ans à Kiev. Donc je suis parti, je suis revenu entre-temps une fois j'ai pas pu participer parce que je sortais d'une réunion au ministère. Là, je suis désolé. Donc je vais pas, je vais peut-être reprendre des choses qui ont déjà été dites. Moi, dans la situation actuelle, j'ai une question simplement sur la coordination de ce que fait Expertise France. Est-ce que vous avez vos priorités en termes de population vulnérable, bien que pour moi, toute la population ukrainienne soit vulnérable actuellement. Je suis en ligne quasiment tous les 2 jours avec des gens soit à Kiev, soit à Dniepro. Euh, je voulais savoir comment ça s'articule avec d'autres initiatives. Alors, je parle même pas européennes, mais françaises, en particulier la somme que la direction du Trésor, qui à ma connaissance est de 200 millions, va mettre en particulier dans le domaine de la santé et sur les équipements. En d'autres termes, quel est le mécanisme de coordination entre les différentes institutions françaises qui interviennent actuellement en Ukraine? Je ne parle pas en général, mais en particulier dans le domaine de la santé au sens large. Merci.
Merci beaucoup. Je vais me permettre de répondre à cette question. Donc, on travaille Expertise France au sein de l'équipe France en Ukraine. On travaille avec l'ambassade, le poste, notamment le service économique et la DG Trésor, donc spécifiquement
Pour le fonds Ukraine, donc sur les 200 millions que vous avez mentionnés, un peu plus de 50 millions sont destinés à des projets, 7 projets sur la santé. Et ensuite, on travaille donc dans le cadre du programme Santé d'Expertise France qui finance le bureau de reconstruction du ministère de la Santé. On travaille comme un pont, une passerelle entre la DG Trésor, les compagnies françaises, les boîtes françaises qui ont été sélectionnées, le ministère de la Santé et les hôpitaux pour permettre une harmonisation des activités et des livrables dans la manière où ces activités s'inscrivent. Donc, bien sûr, l'Expertise France et le groupe AFD en général ont pu donner leurs avis et validations en général sur les différents projets santé qui ont été proposés au Fonds civil. Et ensuite, à savoir que c'est pas juste le Fonds civil, c'est aussi les financements, plus de 50 millions de financements du CDCS, du centre de crise, qu'elles aillent à Expertise France ou aussi aux ONG. Il y a aussi donc le fonds civil, vous l'avez mentionné, mais il y a aussi les prêts concessionnels qui ont été faits par la DG Trésor, qui sont d'à peu près 50 millions d'euros pour l'Ukraine pour l'instant. Donc, ce sont deux projets, un projet d'infrastructure, un projet d'équipement. Donc voilà, il y a une harmonisation et une concertation, une discussion, mais aussi un soutien de la part d'Expertise France sur la mise en œuvre de ces financements.
Juste pour préciser encore une fois ma question, merci beaucoup pour votre réponse, mais simplement le mécanisme. Encore une fois, je n'ai aucun commentaire à faire, puisque je ne le connais pas. Mais je sais, je suis par exemple en relation aussi avec la PHP, qui travaille énormément, qui a fait un centre en particulier d'aide à la chirurgie à Lvov. Il y a des centres de rééducation. Encore une fois, qu'on dise on met ensemble les choses, on harmonise, on essaye de travailler, j'en suis persuadé à 100%. Simplement un petit peu être plus précis sur le mécanisme de coordination. Je vous dis ça parce que j'ai beaucoup vu dans mon expérience des aides, des soutiens, des contributions, des appuis parallèles avec des mécanismes de complémentarité, de synergie, de cohérence et de coordination qui étaient relativement faibles. Alors je sais qu'en Ukraine, il y a quelqu'un alors, je ne sais pas si c'est vous, je ne sais pas quelle est la personne qui au niveau à Kiev coordonne toute cette aide. La seule question que je voulais savoir, c'est un petit peu, au-delà de la coordination, il y a une réflexion globale avec tous ces acteurs qui sont différents. Il y a du privé, il y a du public, il y a de l'hospitalier, il y a du non-hospitalier, il y a de l'appui institutionnel comme Expertise France, etc. Donc voilà, c'est ma question. Parce que, et encore une fois, je ne rentre pas dans la collaboration avec les autres donateurs, les autres pays, en particulier les pays européens, hein, mais parce que ça me semble une question importante. Et moi, j'ai pas de retour spécifiquement là-dessus de mes contacts avec Kiev, le retour que j'ai de Dniepro, hein, c'est simplement nous, on essaie de naviguer à vue dans la situation actuelle et que l'aide vienne de droite ou de gauche, peu importe, à partir du moment où elle nous soutient. Voilà. Encore une fois, je vous remercie.
Juste pour répondre à ça, alors,
Mais
d'une manière plutôt brève, il y a des comités il y a des comités qui existent au sein de l'équipe France, donc que ce soit au niveau de la DG Trésor, où on a des discussions avec tous les membres de l'équipe France sur la pérennité, les besoins en santé, notamment l'attribution de financement. Sur la mobilisation de l'expertise hospitalière, vous avez mentionné Superhumans avec la PHP, malheureusement qui s'est arrêté d'ailleurs, où ce sont tous ces mécanismes de coopération hospitalière. On travaille ensemble avec la DEI des ministères sociaux, mais aussi la DGOS où on a un point de vue, donc il y a différents mécanismes de financement et on travaille ensemble sur l'attribution de ces financements, que ce soit des enveloppes EF, des GOS, avec la DUI, mais aussi avec l'ambassade de France. Donc on a un point de vue assez général sur les activités. On essaye de justement de capitaliser en fait sur ce qui est fait notamment en don pour qu'on puisse ensuite venir créer de l'expertise et mobiliser de l'expertise même sur du don d'équipement. Mais on a des comités qui existent et puis des équipes et des groupes de travail
ouais.
piloté aussi par l'ambassade de France. Merci.
Oui, je, si je peux me permettre, c'est Eric Flotelot, là, je suis désolé de ne pas pouvoir être avec vous ce matin, mais la coordination, non seulement elle se fait entre acteurs français, si je compare à d'autres pays, elle est d'un d'un niveau bien plus élevé. Je ne citerai pas les pays où nous n'arrivons pas à nous coordonner en équipe France. Ce qu'on a réussi à faire aussi depuis 2023, c'est une coordination avec les autres partenaires de l'Ukraine qui interviennent dans le domaine de la santé. Et à ce titre, j'ai vu que nos collègues du département d'État américain, du Fonds mondial et d'autres sont présents ce matin à ce webinaire et je les en remercie. Donc, voilà, on est plutôt satisfait du degré de coordination et surtout des opportunités qu'on a pu saisir pour faire des synergies. Moi, j'avais une question pour les évaluatrices. Est-ce que je peux en poser une ou je suis hors jeu pour poser des questions?
Vas-y, Eric.
D'accord, ok. Euh, Compte tenu du contexte actuel de réduction des financements, parmi vos recommandations, euh, les- que- comment oseriez-vous prioriser? Parce que le Fonds mondial, il va peut-être pas pouvoir amener autant d'argent qu'auparavant. L'espoir que le gouvernement ukrainien puisse reprendre le paiement des produits de santé, c'est pour l'instant un espoir. La situation budgétaire est pas brillante. Les coopérations bilatérales, elles sont toutes en retrait si on regarde les grosses données 2025. Comment vous feriez si vous deviez prioriser?
Je pense qu'il y a le temps de la traduction. Ah, c'est bon.
Sorry, I need to switch. Yeah, I need to switch to to the audio. Can you hear me?
Yes.
Okay. So, Eric, I will start and then maybe Maria chime in. I'm afraid that prioritization of interventions, I mean, again, this evaluation was about assessment of what has been accomplished, right? And identifying existing needs and coming up with certain recommendations for the future. I'm afraid that prioritization of specific interventions was beyond the scope, so we won't be able to use the evaluation as a ground to prioritizing or voicing priorities right now. At the same time, we can open up for a discussion, and I think it would be really important and interesting to hear also what all the partners who contributed to this study, have to say in the context of what's happening in Ukraine right now. If you ask me personally, again, I can't quote the study because again, this was not the objective of this specific evaluation. I would say that again, we all observe the shrinkage of the space, and we all observe that the community organizations and work on the ground is a danger at this point in time for multiple reasons, including shrinking funding or not enough funds being raised, as you just mentioned, if I got the translation correctly. So again, that's not a study justified position, but I would say that that should be our priority, definitely saving what we have accomplished through the years earlier.
Thank you, Anna. I think Darren has raised his hand, and I invite you to speak for the Global Fund, I think.
Yes, thank you. Can you just want to make sure, can you hear me?
Yes.
Okay. So my name is Darren Dorkin. I'm the Senior Fund Portfolio Manager for Global Fund for Ukraine. And first, I want to thank everyone for the evaluation. I think it's critical to obviously analyze and report on results that have been achieved with the funding. It's rarely actually done, and so it's much appreciated. But actually, more importantly, I want to just reflect on how impactful and important the support from Expertise France on the initiative has been. In my view, after over 3 decades of working in international development, I can honestly say that it's a best practice for the model. Right after full-scale invasion, there was intense reaching out by the team, and I met with Eric and colleagues from Expertise France on the initiative. And since that moment, there have been clear communication and coordination. The proposals are demand-driven. The gaps, obviously, in the country are huge, and would require 10 or 100 or more times of the actual funding available. But for the most part, the vast majority of the proposals were exactly aligned with, for example, recommendations from our external technical review panel that are complementary to our financing for HIV and TB, both on highly technical issues or areas, but also on organizational issues or even wider issues like procurement and supply chain management, which is, of course, critical. I always found the team and then the by extension, the consultants that were hired to be of the highest caliber and excellent in providing analyses and communication coordination with all the different stakeholders on the ground. It's really it's been a joy actually, and the work has been incredibly impactful, and the results have been presented, I think, demonstrate how much can be achieved in a short period of time by a new sort of increasing bilateral partner. And I also want to emphasize that, of course, establishing the offices in Ukraine and by their numerous visits to the country and meeting with stakeholders on the ground, both national, international, of course, community-based, I think has also been tantamount to the success. We have really, this has been my first experience, honestly, working with Expertise France on the initiative, and I could say it's been, it's so important, given obviously what has been also mentioned in terms of the deficiencies in global health financing, specifically for HIV, but also for TB, at a time when, of course, Ukraine continues to suffer from the ongoing war and continued damage and destruction to the health system, but also gaps in HIV and TB funding. And so on behalf of the Global Fund, I would just like to sincerely thank Artura, Eric, the whole team for all the hard work they have done, for all the results that they've achieved. Of course, also, obviously, I want to extend our sincere thanks to all the national stakeholders who worked very closely with French colleagues on designing and implementing, of course, impactful proposals. And that was that strong collaboration, I think, is critical. And I really appreciate that they continue to work so closely in an area that's so vital, but so challenging at the same time, given the ongoing war. And so I know that the budgetary situation for the future is very unsure, and there have been a number of recommendations, but at the same time, I just want to emphasize that even taking that into account, this is really has been an incredibly important and impactful support, financially, technically, from the country, from the government, and really shows France's, I think, global leadership, honestly, in continuing to support Ukraine, to fight for Ukraine, including for HIV and TB. So again, thank you very much, and we look forward to this important continued collaboration.
Thank you very much, Darren. I see another raised hand. That would be Olga from PHC. I'm sorry, I couldn't pronounce your surname.
Don't worry,
I don't want
Antoine,
to.
at all. I will
Okay.
present myself. Good afternoon, all of colleagues who are in person or who are online. Thank you for this meeting. It's really very valuable. And in general, Expertise France assistance to Ukraine is very valuable. And I must say, from my as a PhD deputy director perspective, that our collaboration became last year's smoother and smoother, and actually really timely response to emergency needs fully evaluated by stakeholders and addressed and supported by Expertise France. So what I see so far, current assistance projects are running, and thanks for them and for covering really emergency needs. But for further, we already started smoother coordination, but at the same time, I believe that implementers, along with the PRs and the Global Fund implementers, it will be good to give them the floor on the CCM meeting to shortly present their results, how they are running, what challenges probably occurred, and lessons learned, and probably already developed tools for further sustainability or for further rollout all over the country. So from my perspective, thanks for latest supports of 3 emergency grants, but let's consider from your side and from ours as well how to give them the floor on the CCM meeting in order to coordinate, because it's overall response for HIV and TB, how smooth we can coordinate and we can manage to implement. I saw Anya's recommendations actually from overall evaluation. I fully agree with some of them. Some of them I'm a little bit out because they should be also aligned with the national strategy, and namely, like I am a little bit worried, let's say, about mobile vans separate package due to the latest situation. It's quite challenging in Ukraine to discuss a separate package from NHSU for these activities, but let's consider how better to integrate them into the overall current services. Thanks once again, and we in close collaboration, and we are looking forward for such collaboration in future.
Thank you very much, Olga, for this overview and feedback on the evaluation and the recommendations. It's duly noted. Are there any other questions, discussion points that wants to be raised? Otherwise, I will.
Antoine, I don't have any ends to raise, but if you allow me, I would like to also make two other comments. If I may speak in English, it could be perhaps more easy for our Ukrainian partners to understand. So there are two points. The first point, I was like you in Georgia. I coordinate after I retiring of UNAIDS from Moscow and I went to Ukraine. I coordinate the twinning project funded by the European Union on the children with disability, which is called intervention précoce. You watch a kind of institutionalization project. It was in Odessa, in Lviv, in Kharkiv, and in Uzhgorod. So for more than 1 year, it was 1 year and a half, there was a huge work has been done. This is a very vulnerable population. There are children with disability. The project was amazing, the outcome also. And I just want to know if Expertise France, which was completely involved 100% in this project, capitalized or leveraged on what has been done. It was in 2018, and it's ended in 2019, but there is still some work which has been done, and perhaps it could be related to the mental health component of Expertise France activities now in Ukraine. The second issue is for the Global Fund and for the UNAIDS and for all the partners. I face a situation, but probably you already anticipate this. I face a very difficult situation in 2014 when there was an invasion of the Crimea and of the part of the Donbass, for the people who at this time didn't really have any more access, not only to antiretroviral treatment, but to substitution therapy, according to the Russian law, which it's not possible to get substitution therapy. So a lot of people, we organized the migration from these people on the Ukraine territory from this Crimea. So regarding the current situation, and what could happen in some territory right now, hoping it will be more peaceful. But there is still, I think, everything has been anticipated. Of course, it's a small population, but nevertheless, to anticipate that they will have access to this all the care management, including the drug, including the substitution therapy, which remain a problem. I know that Ukraine is more in advance in pre-exposure prophylaxis, for example, than a lot of countries, and I hope that Ukraine also will be able to face and to fix its situation. Thank you very much.
Thank you, Jean-Élie. I think you're right about the results of a twinning project that can be capitalized on. I'm sure we can find maybe some deliverables that are still used or used by the Ukrainian counterparts. I think it was the Ministry of Social Affairs, not the Ministry of Health.
Right, it was the Ministry of Social Affairs, but okay, I think there are some relationships, some complementarity and some collaboration between the ministry.
Yeah, definitely we can look it up there. As for the second point, I'm not sure I can answer to it, but maybe some other people have answers or talking points. If you can sum it up, Jean-Élie.
What do you want from me, Antoine? I didn't understand.
Your second point.
My second point is there was at the first in 2014. So now it's not a substitution. In 2014, we have thousands of people, not a lot of it, thousands of people who were living at this time in Crimea and in the part of the Donbass, which now was occupied by the Russian. They didn't have access, especially IDUs, to substitution therapy, and also on antiretroviral therapy at this time, but mainly at substitution therapy. So we will try to organize, and we succeed in in facilitate the migration from Crimea and from this territory in Ukraine for all these people in order to continue to have this this adequate care management, which is forbidden once again for IDUs, the substitution therapy, whatever buprenorphine or methadone is still forbidden. So it's a small aspect, but I just say we should anticipate.
Yeah,
this is more.
Jean-Élie, from what we have seen so far, either from the public service, from the facilities depending from the Ministry of Health, and from civil society organizations who are providing care and treatment, I trust that they would be in the capacity to provide the appropriate care, including substitution therapy for those who are coming from this region. This is what we have seen, and honestly, they have done so far a great job wherever they are. Maybe I'm a little bit afraid about the time, guys. Maybe we have to move on.
Yes, exactly. I think Darren had his hand raised. We will take the last question and then go to the WooClap. It was maybe just an answer, Darren, you wanted to provide?
Yes. Yeah, I just wanted to, since I think Jean-Élie asked about Global Fund also support for what were non-government control areas. I think most people may know, but just to clarify, prior to full-scale invasion 2022, we had continued providing support for different interventions in Crimea and in non-government controlled areas of Lugansk and Donetsk. But after full-scale invasion, after trying many different avenues, we're not able to, and we also follow the government policy on such. So for those areas that are not government controlled, we have no access. And unfortunately, we're not able to continue providing support. But of course, if that were changed, if the government policy were to change, depending upon what the future holds, we stand ready. But I hope that clarifies at least the shift in what happened in post February 2022 with regard to Global Fund support in non-government controlled areas. Thank you.
Thanks a lot.
Thank you,
My
Darren.
best regard to Igor Olienik, Darren. Thank you.
Thank you, Jean-Élie. I will give the floor to Olga. Last comment, and then we go to the quiz. Go.
Sorry, because it started another discussion, but actually I will reconfirm what Darren said, that we, during the invasion in 2014, we had a couple of projects on the non-government controlled territories, but unfortunately for the government institutions, it's totally impossible and even impossible to implement.
Yes.
And actually we will do our best, and even without current programs, we calculated resources for those who will be liberated and for those who will need the treatment after liberation, after joining to the Ukrainian territories. Actually, we are ready to work with those who are in need, but unfortunately only on government-controlled territories.
Thank you very much, Olga. I will now close this session on Q&A, and I will share my screen so that you can use your mobile phone to answer a few questions, a few quiz. So I think you all see my screen and can flash this QR code, and I will then launch the questions. Once I will wait a few minutes for people to join. Okay. So 16 people have joined. Let's wait till we reach 20 and then we start the questions. Or we can start now. Okay, so in one word or phrase, what best captures your takeaway from l'initiative Support to Ukraine since 2022? So you have a few seconds, moments to answer. It can be in French or in English. Oof. Thank you very much for all those words. So flexibility comes quite as a strong word. Cooperation, flexibility, long-term commitment, cooperation. Great. Thank you. That's everyone participated. So yeah, flexibility, as it was mentioned, it's one of the strengths of initiative in Ukraine, especially through the emergency fund and the approaches that enabled us to really start administratively, financially, and also in terms of programmation to really steer our support quite efficiently. So that's a good thing, exactly. Okay, so you see all the words. We can go to the next question. So in your view, which area should be the top priority for the future of initiatives portfolio in Ukraine? We have here 4 options: mental health and psychosocial support, harm reduction and addiction services, support to key population and underserved rural or frontline areas, or 4, institutional strengthening and integration into the national health system. Great. All right, so it seems so approximately 40% now on institutional strengthening and integration into the national health system. I think that's one key answer for sustainability of our results and impact. Definitely different models that have been experienced or implemented by NGOs and models can be also taken up into the national health system, for instance, and definitely the support to UPHC is instrumental in different national and European agenda as well. So it's paramount. And the second coming is support to key population in underserved rural or frontline areas. Okay, let's go to the third question. What do you see as the main challenge to ensuring the sustainability of initiatives achievements in Ukraine? So this is an open question, and you can be creative. And yes, we have already some questions, some answers coming in. We see budget, fundings, budget is coming a lot, geopolitics, and definitely also geopolitics and the war. Yes. So yeah, as we say in French, l'argent est le nerf de la guerre. So that's very much on point here. continuity of war and further destruction of infrastructure, definitely the war. Yeah. Okay, well, thank you very much for all this, those answers. This has been very great for getting some feedback, and we see that you have followed the presentation and the discussions quite attentively, quite well. I will now give the floor to Eric for a few closing words. And I thank you again, I thank again all the partners from Ukraine, France, in l'initiative as well as outside Expertise France. And I give the floor to Eric.
Merci. C'est OK si je parle en français? C'est bon?
Oui, oui, oui.
T'es- Franchement, on n'avait pas imaginé pouvoir mener quelques 2 ans et demi après avoir repris le soutien à nos partenaires ukrainiens ou à des nouveaux partenaires ukrainiens, une telle évaluation externe. Je veux remercier avant tout le CERA, l'unité suivi évaluation et puis les évaluatrices qui ont travaillé là-dessus, parfois dans des conditions différentes. Ce que je retiens, c'est que malgré les contraintes qui étaient assez inédites, même si je remarque que depuis quelques années, il y a une spécialisation de l'initiative dans les pays en crise et dans les pays les plus faibles, je retiens que les 3 modalités de l'initiative ont été mobilisées pour pouvoir soutenir la continuité des services de prévention, d'accès aux soins et d'accès au traitement contre la tuberculose et contre le VIH. Qu'en matière de pertinence et sur la question de la flexibilité, ça a été rappelé il y a peu, on a dépassé les objectifs qu'on s'était fixés. On a pu répondre facilement, on a pu reprogrammer facilement. Et dès le début, on a travaillé en coordination avec les plus gros bailleurs sur cette thématique pour pouvoir combler des gaps et construire des ponts entre des activités pour lesquelles il n'y avait pas de pont. Au-delà de cette question de la pertinence et de l'efficacité, je veux noter que quand nous prenons un peu de recul sur toutes les données, et Dieu sait si Laetitia, Victorien nous ont fait infuser une culture de la donnée dans notre équipe, je remarque qu'il y a une vraie efficience. C'est-à-dire que si je compare les moyens qui ont été mobilisés aux résultats qui ont été obtenus, on fait mieux en Ukraine que dans beaucoup d'autres pays. Et donc, c'est vraiment, comme on dit en anglais, good value for money, que d'avoir investi autant d'argent. Les résultats, ils sont solides aussi, c'est-à-dire que même dans des activités qu'on ne pouvait plus continuer de soutenir, on voit qu'elles existent encore. On aime beaucoup cette solidité des résultats, notamment les approches mobiles au plus près du front, les approches communautaires qui sont évidemment centrées sur les besoins de ceux qui sont les plus vulnérables, mais avec une ouverture. Je vais prendre 2 exemples. Les cliniques mobiles de Alliance for Public Health, elles font bien au-delà du VIH et de la tuberculose. Elles apportent des soins indispensables à des personnes qui sont isolées dans des villages près du front. Les cliniques qui sont gérées par 100% Life, elles vont bien au-delà du VIH et de la tuberculose. Elles accueillent aussi, de par leur coût réduit et la qualité des soins de la population en général. Et je le sais d'autant plus que je sais qu'il y a des salariés ukrainiens d'Expertise France, du bureau d'Expertise France, qui vont se faire suivre dans ces cliniques. Donc on a eu des retours très très bons. J'ai compris le contraste de l'évaluation sur l'assistance technique. C'est toujours plus compliqué de mesurer des résultats pour de l'assistance technique, même si on sait que certaines ont contribué justement à renforcer cette formidable résilience à la fois des systèmes de santé, mais aussi des communautés pendant ce contexte de guerre qui est absolument abominable. Mais comme partout, la guerre, c'est moche partout. J'étais jusqu'à hier en Birmanie, je peux vous assurer que voilà, c'est la même chose. Euh, je ne suivrai pas les recommandations de l'évaluation sur la visibilité de l'initiative. Euh, c'est vraiment secondaire pour moi. Ce qui est prioritaire, c'est de pouvoir mobiliser de nouveaux budgets pour 2026, 2027, 2028 pour pouvoir continuer notre soutien avec ce qui a été rappelé à de nombreuses reprises, y compris par des intervenants, la nécessité de mieux intégrer l'approche santé mentale, y compris pour les soignants eux-mêmes, pour ceux qui aident en transversal dans tous nos programmes. Merci.
Merci Eric
Merci à
pour cette
vous.
formidable aventure.
Tu veux dire deux mots?
Non, pas de-
Très bien, merci beaucoup Eric. Merci à toutes et tous pour votre participation à cette session.